Hello, my name is Valerie Medina. I am a student in the FNP program at UTEP, and today we're going to be performing an abdominal assessment on our patient. We're going to put some gloves on. As soon as we go into the room, we're already looking at our patient. Right now she looks calm, she's cooperative, she appears to be in no distress. She's alert, oriented ×4. So now we're gonna proceed to move on by asking her to lay down. Can you go ahead and lay down, please? Okay, now the patient is laying down. We're gonna gently lift up her shirt and bring her pants down. Right now we're inspecting the abdomen area. We're looking at the color, we're looking at the size, make sure it's symmetrical. Her color looks normal for ethnicity. We could touch for temperature. There's no obvious masses, nothing, no scars, no stretch marks, nothing is pulsating either. So just by inspecting it, everything looks normal. And then we're gonna go ahead and move on to auscultating the bowel sounds. Okay, and we're gonna start in the right lower quadrant. I'm gonna go ahead and listen to your bowel sounds, okay? Okay, bowel sounds are normal active in all 4 quadrants. After auscultating, we're gonna go ahead and move on to palpation. We're gonna start off with lightly palpating the patient's abdomen, looking at our patient and making sure that there's no pain or any tenderness noted. So we're gonna start off with light palpation. Any pain? No. Any tenderness? No. Okay. After auscultation, we're gonna go ahead and move on to percussing the abdomen. We wanna hear tympani. Okay, everything sounds normal. While we perform deep palpation after light palpation, we also have to check for any rebound tenderness. We're gonna go ahead and do that. There's no rebound tenderness in the patient, meaning that there's no obvious signs of peritonitis, appendicitis, or anything related to the GI system. We're also palpating the liver edge. Okay. No masses or anything like that noted, no tenderness, also no obvious pulsations. And then we're gonna move on. We're already palpating the liver. We could already move on to estimating the size of the liver, and that's gonna be along the right midclavicular line. And we can start off by percussing it. Okay, by percussing the liver, we kind of estimate, well, her liver should be 6 to 12 centimeters in size. That means her liver is not distended, no fatty liver or anything of that sort. And then we can move on to percussing the spleen for any spleen enlargement. And that's going to be done along the trough space. So we're going to go ahead and percuss here. that sounds normal too. Last thing before we ask the patient to sit up, we're gonna percuss the urinary bladder, checking for any distension or tenderness, and that's gonna be right here. Any tenderness? No, no. Okay. And then finally, we're gonna assess for any costal vertebral angles, which means CVA tenderness. Okay. Any tenderness? No. Come on, yes. Okay. That concludes our abdominal assessment. We inspected, we auscultated, we palpated, and we finished off with percussion. Thank you.